In the next edition of It's About Money, my guest will be Dr. Ned Nicosia, and we're going to talk about put your money where your mouth is. Join us in that program. Hello and welcome to another edition of It's About Money. I'm Nannette Nocon and thank you for joining us. My guest is Dr. Ned Nicosia, who's a dentist in Rochester, New York, and we are here to talk about putting your money where your mouth is. Thank you very much for being here, Ned.
Well, thank you for having me, Nannette.
So our smile is so important in making that first impression, and we tend to be more confident when our smile is, and we have good teeth. So it's amazing how much money people put in their dental bills. As a financial advisor, I see that sometimes as unexpected cost. So I'm glad that you're here because I'd like to ask you to talk about some of the steps for proper dental care so we don't have these surprises that pop up.
Well, it's funny when you asked me to speak about it and I came up with put your money where your mouth is. The other working title I had is Save Money, Go to the Dentist, which sounds sort of strange, but I think as we have this conversation, we'll realize that the more you take care of your teeth and more preventive in that nature, that your bills and finances, everything, it will make a huge difference on what you spend. So the point of this is that with proper dental care, that fewer surprises and fewer cash outlay.
Sure, absolutely. So if you kind of plan out what you spend for proper care, you don't have these big surprises midstream.
Exactly.
Yeah, that's great. So what makes practicing good dental hygiene a challenge for many? I mean, it's just, you brush your teeth, all that stuff, which we'll go through in lots of details. But what do you think is the reason for this big challenge for people to adhere?
Well, part of it, I think, is time. We have so much demand on our time that even something as simple as brushing your teeth, we tend to rush it because the recommendation is for 2 minutes. And when you have to time 2 minutes, it just seems like such a long period of time. Even with children, it's even more difficult. My own kids go brush your teeth, and it'd be zip in, zip out. Did you brush them? Yeah, I did, Dad. And it's like, well, and now actually we have timers that we use, and some of the toothbrushes actually have them that will time the 2 minutes. So I think it's a matter of making the time and then turning it into a habit so that you're repeating it. You're brushing your teeth twice a day, but before you go to bed at night, you're flossing, you're brushing, using an antiseptic rinse. Mm-hmm. and just taking care of it. So I think once you get it to become routine, then it's much easier.
And what age do kids have to start looking at dental care? I mean, for their first couple of teeth? I mean, sorry for this silly question, but how?
Well, no, that's not that silly because especially first-time parents ask that quite a bit. And I mean, a 1-year-old really not going to be able to brush their teeth too well or even let chew. So even at that age, using a washcloth just simply to wipe the teeth, make sure they're clean, let them brush their teeth, but then as they, and it varies as the maturity increases, then just spending the time and letting them know how important it is. And we introduce them into the dental practice as early as age 2, and usually when one of the parents are getting their teeth cleaned, so at least they can observe. I've heard that the dental office is scary for some adults. I don't know, but and for kids, just think about how they would feel. So we introduce them and to something when the parents are getting their teeth cleaned, and they'll get a ride in the chair, and the more familiar they are with the office, the better that they do.
Sure, there's really familiarity rather than building up this fear of, oh my gosh.
Absolutely.
So you've talked about brushing the teeth and a rinse, antiseptic rinse. What about flossing? How important is flossing?
Well, flossing is extremely important because that's the only way to get in between the teeth, and it does go down below the gum about a millimeter and a half. And that's where plaque and bacteria is building up. Brushing only removes what's on the surface of the teeth, so this was the only way to get what's in between. And at regular visits, we can see who's not flossing their teeth because you can see the start of decay in between the teeth. Not on the biting surface, but in between. And you ask, well, how's your flossing? It's like, well, it could be better, which means that they're probably not, and that's where they need to improve.
I see. So you could give them all the patients an A, B, or F.
Well, exactly. And the other part, though, that people don't realize is brushing your tongue. I mean, the mouth is just loaded with bacteria, and just think one of the best places for bacteria to hide is in all the crevices in one's tongue. So there's brushes, and actually is a tongue scraper that will help remove the plaque and bacteria that is deposited on everyone's tongue.
Oh, that's interesting. You know, I never think about that, but what a great idea. You're absolutely right. Of course you are. You're the dentist. But now, why do people, what are the obvious reasons why people don't want to go to the dentist regularly to have a professional cleaning done by a hygienist, for example?
Well, it's not fear, as you would think, but what I hear most of the time is, well, nothing hurts. My teeth don't hurt. And that's the wrong way to approach it, because normally when they are hurting, it's a bigger problem. Either decay has gotten very close or to the nerve, or there's another issue going on. So that's not a good gauge of whether you should go to the dentist or not. And I mean, that figures into what we're talking about, putting your money where your mouth is. Proper home care obviously is essential. Regular professional dental cleanings, at least twice a year, you know, we vary it depending on the patient, is also important. That's the only way that the tartar or calculus that we call it, and plaque that's deposited can be eliminated. You can brush your teeth as much as you want, but once the tartar forms, it's impossible to remove. And don't forget, some of the plaque is deposited below the gum line, and that's full of bacteria. You know, 2 or 3 millimeters down, you can't get to it. So it's just sitting there and will cause an array of problems. So it's a more, you know, preventive approach. And then, you know, the third part of it is the dental checkup that goes alongside with that, and which is very important. During that visit, the necessary x-rays are taken, which is the only way to see what's going on in between the teeth, underneath the fillings, and with a Panorex in the bone. And it's an important piece of information. A thorough exam is done where you can, you know, clinically see if things are broken, chipped, or there's a problem going on or missing. But also, there's a periodontal exam that's done where periodontal disease is episodic. So you may have a period of time where there's no periodontal disease, but then in a very brief period of time, a lot of activity. So that's very important to be, you know, monitored. And then there's an oral cancer screening too, which is obviously, you know, is extremely important.
So help us for our audience. What is a periodontal care? And I'm not saying it properly. Periodontal care. What does that mean?
Well, I mean, periodontal care is basically care of the teeth and the gums and the bone. So periodontal is really related to the gum. Periodontal disease, which actually affects 1 out of 3 adults to some degree or the other, what that can lead to is irritation, infection of the gums, but then advances to bone loss. And that's why a more preventive approach is a lot more cost efficient, because in the past it'd be like the first sign of periodontal disease, well, your teeth are loose, you know, and now it's much more, you know, preventive. That's why on a regular, every 6 months, it's measured. Any changes, whether it's bleeding, whether it's pocket length, which is, you know, which parallels or matches what bone loss is an important piece of information, because if you miss a couple months, years, you know, that change can happen pretty quickly.
Yeah. Absolutely. You know, so I guess you can't look, it's not like looking at your car and saying, I need a car wash. You really have to make it routine, whether it's every 6 months or however, you know, is necessary for your own dental care, right? You just can't say, oh, you know, it's like, my teeth are fine.
Well, I won't right, go. It doesn't bother me, and I can understand, too, in this, you know, economic times that, well, you know, maybe I won't go to the dentist and say, but the problem is, especially in dentistry, during that regular visit and the exam or the checkup, whatever you want to call it, it's that everything is looked at, and sometimes recommendations are made. And recommendations that, if they aren't taken care of, that in another 6 months, it's a bigger problem. And not only is it more expensive, but it's a much bigger procedure to go through.
Sure, and probably take more time. So if someone's really pressed for time.
Right, as it advances, I mean, the problem advances. So, and then the solution advances. So what I'm saying is proper, you know, cleaning and care, but, you know, and just taking care of things when they're small prevents a lot of surprises, but also big expenses.
Now, help me with the selection of toothbrushes. When I was a little girl, I was told that you should use the hard bristle, but it doesn't sound like that was right. Of course, I'm ancient now, so it's
right. No,
that was a long time ago. But
they changed that a long time ago because the hard brushes did a great job of cleaning the teeth, but they also did a great job removing the enamel. And you saw the gums would recede, but it was just too abrasive. So we're definitely recommending a soft toothbrush. And that's another financial advantage of regular dental treatment, or regular dental checkups, because you leave with a free toothbrush,
Yeah, right, that's right.
toothpaste, and floss.
Oh, yes, yes.
So look at, you've already saved and made back some of your money.
That's right, absolutely. You're absolutely right.
But some of the the electric toothbrushes are very, very efficient, and people have great results with them. Some just rotate, but the other ones actually work ultrasonically to loosen up the plaque.
I see.
And the research behind those, and they're timed. So
I imagine, too, that someone who might have difficulty as they get older with arthritis or whatever, brushing with something that's electric makes it a lot easier to clean instead of having to, do that motion.
And I guess the key is also spending the time doing it. As I say, 2 minutes, like if we just sat here and didn't talk to each other for 2 minutes, that's a long time.
Sure, right, absolutely. You're right. Got to have some sort of, there's a business opportunity there. Find out something to do in 2 minutes besides brushing your teeth. But you're absolutely right. That's very important. And what about dental insurance? Do you find that most people carry dental insurance these days?
Well, I could talk for 2 hours
on that alone
about dental insurance because in practicing dentistry, I think maybe even 10 years ago, maybe every other person had, 50% of patients had dental insurance. And dental insurance is a little bit different than medical insurance, that it was set up initially to help pay for a procedure, but was never meant to cover the whole procedure. Mm-hmm. And just the way that medical insurance has gone, and dental insurance has gone too, where it seems like it's covering less and less. But I guess the biggest point is 20 years ago, they have yearly maximum allowances. And 20 years ago, most insurances, their allowances were $1,000 to $1,500. Today, their allowances are about $1,000 to $1,500. Think about how the value of the dollar has changed, over the past, 20 years. So it's, for a lot of procedures, the insurance isn't really covering that much, and it seems like they're covering less and less, and they'll cover the least expensive procedure, not necessarily the best procedure.
I see. So you really have to weigh out what possibly your dental needs are, whether
and
or
if
not.
you didn't have insurance, and let's say your dental needs are quite limited just to the regular checkups and cleaning, you would actually pay more out of pocket for insurance in most cases than you would pay if you just went to the office and paid for your visit.
And save money and have a little dental account or something like that, for medical and dental. So what about other things such as diet? I mean, how does diet affect dental, health of your teeth?
Well, it's a very interesting question, and of course, sugar comes to mind with everybody, candy, obviously along those lines. But what people don't think about is it's not just sugars; it's actually complex carbohydrates. Oh. So, and actually, chocolate, the saliva actually will dissolve chocolate and clean it out pretty well. Something like a potato chip, no. You think you eat some potato chips, how tenacious they are. And they'll stay in your mouth for a while unless you brush your teeth. And that's actually forming the sugar. And what happens, that's what the bacteria is feeding off of. And that's what actually is causing the decay, the acid that is formed.
Nice.
So I just read that a 20-ounce Mountain Dew has over 26 tablespoons of sugar in it. Mm. So that's actually one of the biggest things that I've seen in practice are sodas and sports drinks and energy drinks. And then, which we actually will talk to the patient about their nutrition and what, is causing this. And because even, and a patient will say, well, I just drink diet soda. Well, the other part that people don't consider is that diet soda, the carbonation is made from either carbonic acid or phosphoric acid. So normal mouth, your pH is a little less than water, about 7. The pH of soda is 2.5. It's acid. So that's also dissolving and eroding away the enamel. So, which is also creating problems. So don't be fooled by diet soda. It's still causing dental problems.
I see. Wow, amazing. And then like candy, like if a child sucks on a lollipop or sucker, it just keeps all the sugars in there.
And all those gummy treats that they like, and those are also very tenacious in terms of sticking to the grooves in the teeth. And
I see. So if you're going to have any of those, be sure to brush your teeth immediately.
Oh, absolutely.
Actually, it's funny, after I brush my teeth and somebody offers me something, like I already brushed my teeth. You know what I mean? It's like, my biggest fear in life is losing all my teeth.
That's a common nightmare I think most people have.
Like, oh my gosh, if I lose all my teeth. So great. And so in terms of diet then, are there foods that help out? So really, if you build calcium, bone. So like soda, for example, like you said, it's got phosphoric acid, which competes with the
Right.
absorption of calcium and all that. So, but calcium supplements or?
Oh, I mean, absolutely. But it's actually, and you don't want to just focus on the mouth. It's your whole well-being that then and proper dental care and having great oral health affects your overall wellness. So it's not just separating one from the other. I mean, we should all be eating healthy, whether it's obviously we don't always, but that all affects fresh fruits, vegetables. Stress can manifest itself in the mouth, whether it's with abscess ulcers or different things along those lines. So it all figures in. And another thing that we're seeing that with the amount of medication that a lot of people are on, a lot of those medications have some type of effect in the mouth. Normally it's xerostomia, which is dry mouth. And since saliva has a cleansing function, less saliva, there's less cleansing. So it's even more important that they're spending extra care brushing their teeth, but also there's fluoride supplements that can be used usually in a mouth rinse form. Also, because they're just not getting that cleansing function. So that's what we're seeing as our population ages is much more medication.
So really, when patients see their doctor, their dentist, they ought to be disclosing the kind of medications they take because it might affect
At
their
every
dental care.
checkup, their medical history should be updated in terms of what medication they're on, and an important piece of information.
So take the time to write it down rather than forgetting it. It doesn't
Absolutely.
affect it because it really matters.
It is important to have because sometimes the patient will be like, well, it's a little blue pill, it looks like that, you can draw a picture, but it's an important piece of information. If we're not sure, then we'll just follow up with their physician to see what they're taking.
Okay.
But it's amazing a lot of people don't know what they're taking.
We'll take a quick break here. My guest is Ned Nicosia, a dentist extraordinaire, and we'll be right back.
You may not know what to say, but we can help start the conversation. Learn more at supportyourvet.org.
And we're back. I'm Nannette Nocon. My guest is Dr. Ned Nicosia, and we're talking about putting your money where your mouth is. So thanks again for being here, Ned.
Pleasure.
I appreciate it. Let's talk about some catastrophic things. These days, young adults are getting involved with sports, even young children. What kind of injuries have you seen, and what can people do, or parents do, to help their children from damaging their teeth from being active in sports?
Well, the biggest thing that they can do is a proper fitting, professionally made mouth guard. For the past, it must be 20 years, I've been the team dentist for the Rochester Americans hockey club. And I've seen it all, and the evolution of the mouth guard. And the problem is, especially early on, when children get into sports, and a lot of the sports require mouth guards, some don't, but you'd be surprised at the sports that they should be wearing a mouth guard, such as soccer, basketball, because usually it's a shoulder, elbow, they get hit. But the problem is that what happens when they start playing is that they'll go to the sporting goods store, and they'll get one of the mouth guards there that are boil and bite. You put them in boiling water, heat them up, put them in the mouth and bite. And the problem with that is as soon as you bite, the material's distorting. And it's getting very thin. It's not giving them the level of support that they need. So why a professionally fit mouth guard is, and I'm in the Academy for Sports Dentistry, and the research is behind it that actually, depending on the sport, we'll make a different mouth guard. And for hockey, it's made in layers, and it fits very intimately on the upper teeth. So much so that I could pour a model inside the mouth guard and have an exact duplicate of the original impression that I took. And the problem is to get that switch over, because they're used to the ones that they boil and bite, not only do they not fit well, they can't talk, which is very important to communicate to your teammates, and they're uncomfortable. So once they start wearing these, and knock wood, as long as you wear them, we haven't had one athlete lose a tooth while wearing one of the mouth guards.
Oh, wow. So really, if you want to save your teeth, you're going to get involved in a
because you
sports
want to
contact.
talk about expense, then, when you lose your teeth. Now, with children, especially sports age, a lot of them are in braces. Even more important because not only because they have injury, but don't forget the teeth are attached by wires, so it's like dominoes. So it's very important that most kids in sports that have any type of contact wear a mouth guard.
That's fitted for them.
Absolutely.
Yeah, rather than that. Yeah, gee, I never thought of
And
that.
the other advantage of a mouth guard, and there's some research behind it, is that it indicating that it does decrease the chance of concussion. Because when someone gets hit in the jaw, the lower part of the jaw, the condyle, is actually hit up into the thin plate of bone, which is basically below the brain, which causes the concussion. Well, the mouth guard actually causes the teeth to disengage a bit, so it makes that action impossible.
Oh my, okay,
So-
gee, I never would have thought of that. So it really has some extra benefits besides just protecting your teeth.
Absolutely.
Yeah. Oh wow, that's great. That's great. Now, so losing teeth. When I was little, a lot of my grandparents wore dentures. I mean, pretty much removing the dentures, But is that common these days to find people wearing dentures like that, or is it not?
Well, I mean, it used to be acceptable that you're in your 40s that you have dentures, and to be honest, each year I make fewer and fewer dentures, and I mean, that's the exciting thing about dentistry today is the technology, and you don't have to have dentures anymore. I mean, with implants, there's so many options. With implants, there's something like a denture, but it's implant supported. So not to oversimplify it, but almost like a trailer hitch, the implants, it'll snap in, because the problem with a denture is you have about 1/5 or 1/6 the force of your normal bite. Because it's just sitting there, and the only thing holding it in is whatever suction you can hope to get, and that's dependent on the amount of bone that's there. And the upper denture is covering the roof of the mouth, so your taste is gone. So we try to avoid that. And the other part of it is what we talked about earlier, all the preventive care. Fewer people are losing their teeth and holding on to them to a lot longer.
That's great. So people are smarter about the dental care. You're right. As a child, I remember people, my aunts, they all
Oh, absolutely.
like, oh boy. So now I'm past that. So thank God.
Right. You made it.
Yes. So I'm glad to hear that it's not as prevalent as before. So it seems to be these days that there are a lot more people with really good-looking teeth compared to before. People would have like different formations in their teeth, but kids tend to have their teeth all lined up nicely. So it's more common for people to really pay attention to.
I mean, it is, and I mean, there's a cosmetic aspect of it, but there's also the preventive aspect of it. And with orthodontics, I mean, most kids will need braces. There's just not enough room in their mouth. But I don't know if you remember, like when I was in high school or in grade school, there was kids, I swear they had braces like for 6 or 7 years. And now, sometimes we'll recommend interceptive ortho treatment, which they'll have some braces or something done when they're younger, but they still may need braces later on, but not for as long. So it's planning instead of waiting for something to happen. It's more planning for what the situation is, and it's just, the whole idea is predictable results.
Oh, that's great. That's fantastic. I think that's really great. So let's see. One of the other things that I want to talk about is they've done some research, as you've mentioned in our previous conversation, about the relationship between heart disease and good dental care. Can you talk about that a little bit?
Absolutely. As we talked about before, the mouth is just loaded with bacteria. Probably no other place in your body has as much bacteria that's there. And some of it's in the plaque, some of it is deposited below the gum line, and the perfect highway is the bloodstream. So what has been shown is some of the bacteria that's found in the mouth, especially when there's periodontal disease or there's an abscess, can enter the bloodstream and attack the heart. Normally it's in the form of subacute bacterial pericarditis, which is a infection of the heart or the lining of the heart, or an area or a valve that's susceptible to it. But there's any bacteria that's in there, and so there's an important issue. And actually, I just read an article from the American Heart Association, and their research shows that people who have regular cleanings twice a year at a dental office have a 24% less chance of having a heart attack. And once again, the bacteria that's attacking either the walls of the artery, the heart, is there. And if it's in your mouth, it's going to very easily enter the bloodstream.
Sure, that's right. It's all connected. You can separate it.
Absolutely.
Yeah. So that's really one more great reason to be practicing good dental care. So I thank you for coming here, because dental care is so important, and it does put a dent on someone's financial picture with cash flow, cash reserves, that kind of thing. So let's summarize some of the things, ways to save money on unexpected dental bills. So let's summarize with the checkup.
Oh, absolutely. Well, what we talked about before, proper dental care at home, taking care of things. regular dental professional cleanings and the checkup in the office. But the other part of it is taking care of things while they're small. If a recommendation is made, if there's decay in a tooth and you want to wait, well, I guarantee it's not going to be less decay in the tooth 6 months later. You know what? And if you wait for something to bother you, it's going to be a bigger problem. So it's more, as I say, more expensive. So that's a big part of it. And the other part is, it's very expensive. So my goal, and there's always options. So how I always look at it is, first of all, the more information you collect, whether it's with radiographs, examining the area, consultation, the more predictable the results. And there's always going to be options. And I think it always should be the patient's decision, but I think it's my job to make sure it's an educated one, that you know what's going on in your mouth and what options you have. Everything has a pro and con. Something's more expensive, but, and if you broke a front tooth, let's say, you could have a root canal, you could put a post in it, you could put a crown on it, and 8 years from now, it will probably fail. Or you can do an implant. Definitely more expensive up front, but you only have to do it once. So in the long run, it may work out to be less expensive.
I see. So you really kind of weigh out because there's a replacement issue that comes with it.
And the other part is you prioritize the treatment. Like you may come in and say, I want whiter teeth. Well, if you have a tooth in the back that's full of decay, we need to take care of that first. Maybe the bleaching can wait a little bit and just prioritize treatment. The other thing, if you need a lot of treatment, then sequence it. Take advantage of the insurance if you do have it. But if not, then financially you can just do it in little bits. And the other part is that we see more people utilizing their flex accounts, pre-tax money, and that's why with all the planning, there's no surprise, like you're winging it, well, we changed our treatment plan, now we're doing this. It's like, no, we planned it out. And the more information that you have, then you can plan out. And the other thing is there are financial companies, I think Care Credit is one, where they offer 6 months to 2 years, and a lot of the time it's interest-free. So you can also utilize that to pace it out because we want to make treatment affordable too. And we can understand it's a lot to hit somebody with. And it's like, so if you sequence it or use any of those, I think it works out to your benefit.
Right, so don't make a quick decision saying, oh no, that's an expense, don't do it, but really think about what the ramifications are and find ways to finance it if it's needed.
Absolutely, and I think that communication is key. And I think that as long as the patient understands what's going on and what the options are and what the outcome's going to be and how we proceed, then it's much easier to plan for.
So really, from a consumer or patient perspective, my responsibility as a patient would be to make sure I consume my diet is right with regards to avoiding complex sugars, simple sugars, and then brushing my teeth and using dental floss, antiseptic rinse, and then seeing my dentist regularly and making sure that there's professional checkups, and then having a care plan to make sure that I'm taking care of what needs to be taken. Because I can't really see my teeth besides the front teeth.
No, but exactly. But if you don't and just wait for something, as I said, it'll be a much bigger, more expensive, and much more difficult procedure to go through.
It's just proper to do it. Just do preventative care, really, right?
Absolutely.
Preventative is, and what did they say? An ounce of prevention.
Right, exactly.
Saves a pound of grief later.
Absolutely.
So that's really great. Thank you so much. This has been a great conversation. And it's, like I said, it affects the budgeting, the cash reserves of clients and people who are looking at their finances, and then, as you mentioned earlier, the flexible spending account. That is a very important tool or useful tool in minimizing the expense, not only for medical bills, but also for dental bills, having the tax savings.
Right.
Let Uncle Sam carry some of that burden, right? Well, thank you very much, Ned. It's been a pleasure having you at my show today.
Oh, thank you for having me. I enjoyed it.
And thank you, our viewers, for joining us today. I'm Nannette Nocon, and my guest is Dr. Ned Nicosia. Until next time, we'll see you.
Thanks for tuning in to today's show. If you have any questions for It's About Money, please email Nannette at nnocon@aol.com. This program was produced through Penfield Community Television in Penfield, New York.